Hello, we are here to have a talk about the hernias. Hernia is an outpouching of the human body, mostly from the abdomen, which comes out of the abdominal wall. So we do this hernia surgery by laparoscopy. It is always good to put the mesh from inside. We have seen so many of the patients getting their hernia surgery in their native country or the country of their origin, but the surgeons over there are doing it by the open or the cut method. Hence, there are very much high chances of recurrence. But over here, with the help of advanced laparoscopic machines and as well as robotic, we are here to help the patients with very much complex hernias. And in this condition, patient is discharged in 1 or 2 days of the time with the best quality of the international standard meshes, mostly from America or the German meshes. So these meshes are very much FDA approved and a good quality meshes which last much longer than the patient's own life. The success rate is 100% in all the cases of the hernia because this is a planned surgery and this is done by the laparoscopy. Patient do not have to go to their doctors to get the stitches removed because this is done by the dissolving stitches and the skin is closed by the glue. They can take a shower, roam around and do everything other than lifting any of the heavy weight more than 5 kgs. Different kind of the hernia. We do the recurrent abdominal wall hernia, hernia from the umbilical area, epigastric hernia, hiatus hernia which leads to the acidity, inguinal hernias in the males, or hernias happening after any kind of the previous surgery which was done to them because of any of the reason. So the success rate is very good because we use a very good quality of the mesh and we use the mesh 5 or 7 centimeter much beyond the margin of the hernia. So, and we give at the end of the procedure, we give the CD or the DVD to the patient so that they can have it in the record about what kind of the hernia were they having and what the treatment was done to them. Thank you.